This particular patient came into the clinic with reports of generalized core weakness, a history of diastasis recti after giving birth 2 years ago, and right-sided sacral pain. Upon evaluation, the patient presented with tension in her lower back and hip muscles, weakness in her core and abdominal tissues, as well as impaired pelvic stability. I started the session with soft tissue work to the lower back, hips, and legs to help reduce tension on the sacral area. In addition to that, I helped to mobilize some of the soft tissues in her abdomen to help reduce pull on the midline, as well as improve her overall connection to her core. After restoring mobility in tissues that were restricted, I went out into the gym and I taught the patient how to breathe properly in order to better control abdominal pressure. I also worked on deep core activation in different positions, and then I followed it up with strengthening exercises to support the sacroiliac joint. A lot of the strengthening exercises incorporated the activation of the transversus abdominis, which is a deep core abdominal muscle, in addition to the glutes and thighs. I also tried different positions with the patient on hands and knees, in standing, on a single leg, to help reinforce the activation of these muscles. It's never too late after childbirth to revisit some of these basic principles for core activation. A lot of times we find that people might not necessarily feel like they're fully ready to return to some of the activities that they used to do, like weightlifting or different types of workout classes. It's really good to visit a pelvic floor provider so they can help reteach those principles and you can use them in order to return back to those activities.